Hello world, this is Dr. Kulmeet Kundlas and I'm a primary care physician in Central Florida. Thank you for joining the Masterclass on Gout. As you know, every Wednesday and Saturday we do pick up a topic which is relevant and there is a need to discuss about the topic, and we tend to make a complex healthcare topic into simpler, actionable, understandable bits so that you could understand it and benefit from this time. Why gout discussion is important at this time? As our society changes, the incidence and prevalence of diseases changes. As you recall, in last 2-3 years, there has been a significant change in fad diets, and what we normally eat, there has been a significant deviation, and that deviation is leading to increased incidence and prevalence of gout. These days, ketogenic diet, high protein diet, those are the trend, and as people are eating different from what they are intended to eat, there is increased risk of diseases, and gout is one of them. We in our clinics are noticing about 30 to 35% increase in new cases of gout, and also flare up of acute gouty attack in patients who already have established gout. This is a society driven disease process. No matter which chronic disease you take, it always have a pattern, and the pattern usually is you start with change in your lifestyle that leads to risk factors. Those risk factors leads to chronic diseases leading to end organ damage, and then complication, and ultimately either our demise or pain and suffering. Let's understand what gout is. In gout, there is usually, we could define it falls into a spectrum, acute attack and a chronic gout. If any of us ever had a gouty attack, we will never forgive it. It is so painful. Suddenly it starts at night. About 90% of the time, it starts in a big toe. Suddenly, most of the time, you're waken up and you're having a severe pain in your foot. Your great toe may be red. Even you cannot tolerate touching of a simple sheet on your foot. Why this thing happens, we will discuss today. Then, if the same gout in a chronic phase on ongoing basis when it's going on, that leads to chronic gout, leading to kidney failure, and multiple other organs can fail due to gout. We will explore that part. Gout is a lifestyle disease. As we are getting bigger in size, our body mass index is increasing, incidence of prevalence of obesity is increasing, gout is increasing. There is significant increase in gout, about 74%, if you're obese. If you have a high blood pressure, you have about 40% lifetime risk of developing gout. If you are diabetic, high cholesterol, you are at increased risk of developing gout. Gout and kidney, which we will explore, have a very inverse relationship. If you have kidney failure, you develop increased incidence and prevalence of gout. And if you have a gout, that leads to kidney failure. So they feed on each other. And that is a very detrimental to our body as we go along. Gout is primarily a male disease. Males have disproportionately 3 times more chances of developing gout. Females, so long as they are menstruating, very rarely develop gout at a younger age. If you have one joint where you have been told, or you are having recurrent flare-ups which you have been implicated having a gout, If you are a woman and you're menstruating, you should get your diagnosis reconfirmed. In a menstruating woman, it is very, very rare. Now, what happens? I think a small glimpse into biochemistry is important to understand what gout is. Whenever any cell which has a nucleus dies in our body, or we consume dead cells in the form of meat, fish, and then certain precursors of that, purines and pyrimidines, especially purines, when we consume that, our body metabolizes them into a product which is called hypoxanthine, and there is an enzyme called xanthine oxidase. Under the effect of that, it goes to xanthine and ultimately it gets converted into uric acid. Uric acid does not serve any good function in the body, and it's intended to be disposed of in the urine. 90% of the uric acid which is produced is excreted through the kidney and rest through the gut. And most of the estimate is probably more than 90 to 95% is through the urine and very little through the urine. And now for you to have a gout, that's what makes this disease very complicated. Say for example, if you have xanthine oxidase inhibitor deficiency, your gout uric acid level may be normal, or if your uric acid for one reason or the another, which we will explore, is high, you may not have any evidence of gout. So first thing which we need to understand, everybody who has a gout, 99% of the time, they have high uric acid level, but not everybody who has high uric acid level will develop gout. That is a mystery. We do not know why certain people with such a high level of uric acid do not develop gout, and why people with normal or below normal level of uric acid develop gout. And other factor which is very fascinating is it is not the absolute value of uric acid which in your blood should be less than between 6 and 9, and we'd like to have around 6, not on the higher side. It is not that how high your uric acid is most of the time is how much under certain conditions which we will explore this level fluctuate. You may have a normal uric acid of 6, but if for one reason or the other I can fluctuate the level of your uric acid, you may have acute gouty attack or you may not have acute gouty attack. So that is what makes it very fascinating. So uric acid level, let's put it together. A, it is made from degradation of the cells. Whenever the cell breaks, it breaks into purines and pyrimidines. Purines are adenine and guanine, and the byproduct of that is uric acid. Once this uric acid is produced, that's one mechanism. Your body can have increased turnover of your cells, and certain conditions like, say for example, you have a cancer and you're getting chemotherapy where chemotherapy agent is killing a lot of cells, and those dying cells are releasing a lot of DNA, and which gets broken into purines and pyrimidines, and then leading to high level of uric acid, meaning that your body is producing a lot of uric acid. Second thing could be we could consume uric acid from outside. If we eat a lot of meat, fish, that is a significant load of purines and leading to high level of uric acid. So that's the second mechanism. A, your body is producing extra purines and leading to high uric acid levels, or we are consuming from outside. Third is this uric acid needs to be dumped into urine. Anything which stops dumping of uric acid, that can make the uric acid level go up and it can make it fluctuate. So basically there are three main mechanisms. A, you're producing more. B, you're consuming. 3, you are not dumping uric acid. And all the patients who develop gout ultimately, they are significantly have a problem with dumping the uric acid. Pretty much any class of medication which we take for management of chronic diseases, whether it's heart disease, heart medications, antibiotics, diuretics, or pain medications, all of them can interfere with the dumping of uric acid into the urine. And so they can lead to a lot of issues with building up this uric acid, leading to high uric acid level and leading to acute gouty attack. Gout, the way the mechanism happens is in acute gouty attack or in a chronic gout, this uric acid, when gets to our organs, especially the layer around our joint, it goes there and it gets precipitated into crystals. So we call them monosodium urate, and if you look at under microscope, there are like sharp needles. And these crystals induce a local inflammation, and our white blood cells come in and they produce a cascade of another chemicals, leading to your joint becoming swollen, red, painful. In chronic condition, if this process keeps on going, that leads to damage to our joints, that can lead to damage to our kidneys, and this process continue to do that. And once these crystals get precipitated into our urinary tract, it can make uric stones. Your kidney stones, when we talk about people with gout and chronic kidney disease, people who are on dialysis, they are at very high risk of developing this acute gouty attack and chronic gout. Sometimes these crystals not only getting into your joint as kidney stones, they also get deposited under the skin, and we call tophi. It is, if you ever any of the patient have it, if you happen to see it, you will see the raised skin. It's like a small, large deposits, and if you cut them, this white chalky material comes out of that, and those are called tophi. In United States, there are about 8.3 million people who are living with gout. They are the one who are at high risk to develop kidney stones and kidney failure. Worldwide, there is about 3.9. So it is not a simple innocuous disease. And since our society is changing and we are getting into developing the dietary pattern, which is primarily meats, which are very heavy load of purines, that leads to high uric acid level, that is leading to increased incidence and prevalence. And as I mentioned, but there is about 30% increased risk. It is a major change. And I think one of the biggest drawback of ketogenic diet is that. Now, let's discuss what are the daily habits which we have, which predisposes us to develop gout and its complications. Foods. Out of all the things which we will talk about, there are two things which are very important. Number one, foods which we eat and alcohol. Any diet which is heavy in red meat and certain fishes like salmon, sardines, shrimp, they are also very high load of purines, leading to very high level of uric acid. Those needs to be avoided if you have a gout or if you have a family history of gout. It is estimated that it is very important that if you or your family member have gout, you will develop gout. It has some genetic predisposition. It's not a rule. Like any other disease, your chances are high. So if you are one of those families where uric acid level was running high and they have a gout, you should avoid it. Certainly on the plant source side, beans, whether it's red beans or black beans, they are very heavy in purine load. So sometimes you may be vegetarian and you still could flare up the gout. Next, avoid dehydration. Keep yourself very well hydrated. If you are dehydrated, your volume will go down, and these crystals have increased risk of getting precipitated and leading to increased flare up. Alcohol interferes with the dumping of your uric acid crystals into the urine. Alcohol is a very big trigger. You may have a good night, but you will wake up early in the morning with acute gouty attack. Weight, very important. If you are obese, it increases risk of your chances about by 74% for developing gout. Next is sodas and high fructose foods or fructose corn syrups foods, which are anything which is artificially flavored with the corn derived fructose, that leads to increased risk of developing acute gout and the chronic gout. In our society, these supplemental diets which we are eating, they are very, very high in fructose, corn-derived fructose, corn syrup, and that is leading to a lot of flare-ups. Now, your medications. A lot of medications which you take on day-to-day basis, they can decrease the dumping of your uric acid into the urine. And the most important ones are your aspirin, your diuretics. If you are any of those medications, you will have difficulty in managing your uric acid. Next is vitamin C. This is one of the, in all the studies, vitamin C very rarely turns out to be of any significant use when we talk about medically. But in case of gout, somehow use vitamin C is helpful. So if you consume citrus foods, that will lower the uric acid level and it may help you to control your symptoms. Overall, when you're trying to look at the gout, you will know that usually it involves one joint. Most of the time it is big toe. It can involve ankles, it can involve both knees, it can involve hips, your wrist joint, elbow joints, and shoulder. These are the joints it likes. And why it likes the peripheral joints is because those are the exposed joints, and when the temperature goes down, that is where the precipitation and crystallization happen, and that is the reason that you get the acute gouty attack most of the time early in the morning. So if you are trying to control or look at the disease spectrum, it calls from the stages or the spectrum. If you look at it, it will be, the first stage will be that your uric acid level is high but you have no symptoms. That I will call is asymptomatic hyperuricemia, that your uric acid level is high but you don't have a symptom. Then will be that your uric acid level is high and you get very occasionally high uric acids, or you have very occasional acute flare-ups. That will be, I would say, stage 1. Then if you are developing very frequent acute gouty attacks, that will be stage 2. And once you have a chronically high and recurrent and repeating symptoms, that will be stage 3. But there is no agreement on universally on these stages, but that's how a physician will categorize it from asymptomatic to occasional to frequent to ongoing basis. So we divide medically the management or the course of acute gout into 2 parts. One will be the acute attack, and then there will be the chronic gout. Acute gout, we'll discuss that these crystals precipitate and lead to acute inflammation of the joint. It is a very intensely painful. And in those cases, the treatment is different, the modalities are different. Then is the chronic gout, where you have ongoing the damage to the body, the treatment modalities and these strategies are different. And third is the prevention. What can we do? What can we change? As we were discussing just now, the lifestyle changes and those comes into place. So if you are a gout sufferer, look at into three lenses. One, acute, how you're going to take care of your acute attack. Number two, how you're going to manage this attack chronically. And third is how are you going to manage or prevent gout. Acute attack. In acute attack, as I mentioned, it has nothing to do with how high the level of your uric acid is. And we know very well how high your uric acid level is has nothing to do with the precipitation and leading to acute gout. It has a mind of its own. And so far as a medical science, we do not have a clear understanding of that. Only thing which we know is whenever there is a sudden fluctuation in the level of uric acid, it may be due to dehydration, it may be that you ate more, or it may be that you're not dumping in the urine, this one is, or you're producing more. Whatever the reason is, that there is a change and that could flare up or lead to acute gout, this thing is. In this case, what we do is we use anti-inflammatory medication to suppress that inflammation. We don't do anything to the gout level or the uric acid level. We wait till your acute gout attack is gone and we keep the anti-inflammatory medication. Then we add the medication which decrease the production of uric acid, or we give you medication to dump more uric acid in your urine. But we do it under the cover of anti-inflammatory medications. So this is where very tricky part comes in is. And then if it is your first attack, we do not start lowering your uric acid level because we truly do not understand how quickly that will change. You may have acute gout attack and you may never have acute attack again, or you may start having recurrently. The message is that if you have acute gout attack and you should see the physician, he will treat your inflammation, control your pain, and once they will do the blood work and say, for example, they decided that your uric acid level needs to be brought down and you must continue anti-inflammatory medication, because otherwise once they start the medication, your level will fluctuate and you will have a pain. That is one of the biggest error happen on both on our side and the patient side. Because what they do is patient feels that I'm not in pain now, I should do that, and the physician has given you those anti-inflammatory medication to ensure that when the fluctuation happen in the uric acid level, your level is not 15. Once you have consistently high uric acid level, then what you're doing is you are using medications to dump either uric acid into the urine or stop the production of urine. The common medication you might have heard is allopurinol or fluxostat. These medications work on that enzyme xanthine oxidase, and they cut down and lead to the production of more uric acid, and that's how your uric acid level goes down, and we keep it down. And usually the target is we want to keep your uric acid level around 6. When we are treating it, that's one of the questions we are asked in the clinics is, okay, I'm taking the medication, what is our target? We always treat to the target, and if you are started on a medication to lower your uric acid level, then the number is 6. We want to lower it to 6 milligram per deciliter so that we could keep the level low enough so that you don't get flare-ups, and you do everything where this level doesn't fluctuate. Even at 6, you could have acute gout attack if you do something which is not consistent and your level fluctuate. But at that level, there is no kidney damage and there is no tophi formation. Then what happens with this thing is, or we could use the medications to dump the uric acid into the urine. 2 medications, allopurinol is one of the medication which we all know, and it is very well studied. We start slow and we build up on that medication under the cover of anti-inflammatory medication, and we continue to bring your uric acid level. Then there are certain other medication, foxistat, which also help you to bring your level of uric acid production down. These two medications needs to be started very small dose. Allopurinol is preferred. We have more experience, except in certain Asian population where there is a hypersensitivity skin reaction, and we could do some genetic testing if you are from one of those areas and ethnicity where we could prevent that skin rash which we have. Otherwise, these medications are very well tolerated, but the rash is one of the main concerns. Then the medication to dump into the urine is probenecid, and then we use other medications which will help to dump this one part. For acute attack, we use, as I mentioned, the anti-inflammatory medications like ibuprofen, naproxen, and then there is a medication colchicine which also used in acute thing. Colchicine use for gout attack, both in acute attack and chronic management. It used to be a medication which we have been using it for centuries, and when FDA was established, this medication was not grandfathered in. Most of the older medications, they were grandfathered in, and for some reason the company was able to create some studies on colchicine again and was able to bring back to the market as a branded medication. I guess that's something above us, but they sold this medication twice. Once it was a generic medication and they did a couple of studies and got them into under brand name. But fortunately now this medication is again generic, so it is not very expensive medication at this time. Prevention. As I mentioned, the problem with the gout is the level of a uric acid level does not correlate to acute attacks, and we know for a fact if the uric acid level is high, it leads to chronic complications, kidney and tophi. If we want to prevent complications, we must focus on lowering the load of uric acid. And how we're going to do that is we have a control over what goes into our body. We unfortunately do not control how much uric acid is being produced endogenously or our body is producing, but we definitely can control our diet so that our uric acid level doesn't go up. Regarding certain medications which we could use to help dump this uric acid into the urine for prevention. If you are diabetic, you are at very high risk of developing gout. There is a class of medication which we call SGLT2, Jardiance, and Farxiga. These medications you need to treat it for kidney prevention and management of diabetes. If you are a diabetic, you must ask your physician if you could be started on this class of medication to control your sugar, because not only it will control your sugar, protect your kidneys, also will dump uric acid in the urine, and you will be able to have a better outcome. Number 2, as I mentioned, gout is very common in hypertensive. When we talk about prevention, losartan is one of the medication which is very commonly used for the management of hypertension. If you have a gout, talk to your physician to ensure you are on losartan, because losartan also help to dump this uric acid into the urine. You could make significant dietary changes, including cutting down the load of purines going into the body in the form of red meat, fish, organ meat, red beans, and black beans. Exercise. Moderate weight loss lowers the complications of gout, both chronic and acute. Stress management has significantly shown to decrease the complication of gout. They work indirectly or through our autonomic nervous system, adrenal axis, and it helps to prevent further complications. Avoiding alcohol, staying hydrated. Those are the keys to prevention. So when we talk about prevention, our daily habits, weight loss, exercise, sleep, stress management, and if you unfortunately diabetic or hypertensive, taking those medications which will help, and taking vitamin C will help to dump this uric acid into your urine. People do not heed to these simple recommendations and they continue to get repeated flare-ups. If you are serious in preventing kidney damage due to gout, you must change your daily habits and your dietary habits. Now we get into the section of this masterclass where we answer your most common questions which have been given to us, and we go through each question in detail so that once we get done, if something which I have not covered, it will be covered in the form of your question. What is gout and what's its cause? Gout, as I mentioned, is acute inflammation of a joint, especially our distal joints, especially great toe, but it can involve ankles, knees, wrists, and elbows. It can involve any other joint, but these are the joint most commonly which is this thing. And in gout, there is a precipitation of uric acid into crystals, which we call the monosodium urate, and those crystals lead to inflammation wherever they get deposited, leading to pain, fever, redness. Why people? What are the causes? It's threefold. Number one, if your body is producing more uric acid than what your kidney can dump, or you are consuming from outside, so there is increased load of food which leads to uric acid production. And third, your kidney is not dumping the adequate amount of uric acid in your urine. What are the common symptoms of your gout? Pain, swelling, redness. Those are the acute symptoms. In chronic symptoms, it will manifest in the form of chronic kidney disease, stage 1 to 5, and eventually on the dialysis. But people with gout, they are at high risk to develop kidney stones, which are made up of urate, and also having skin changes, the nodules under the skin, which we call tophi. What is the best test to diagnose gout? The best test to diagnose gout is that once the joint is inflamed, physician will put a needle under septic condition, draw the fluid, check those crystals, monosodium urate crystal under the microscope. But that is very rarely required. Most of the time it's a clinical diagnosis and your symptoms and clinical patterns together, and you will have the diagnosis. But as a part of workup, you will have your blood work where we will monitor your uric acid level, and we will also monitor your kidney functions, that how much uric acid you are dumping in your urine. What food should be avoided if you have a gout? Very clearly, gout is related to increased production of uric acid. Uric acid is produced from purines, which comes from dead cells, because these dead cells have DNA. DNA has two parts, purines and pyrimidines. Purines are made up of adenine and guanine, and when that gets into the body and has to be metabolized in the form, and ultimate product is uric acid. And this uric acid level, anything which is meat, red meat, organ meat, certain fishes, sometimes red beans and black beans, that can lead to high uric acid level and can lead to precipitation of gout, and you should avoid these foods. Then alcohol must be avoided because alcohol leads to decrease in dumping of the uric acid into the urine. Also, you should avoid dehydration because that will lead to decrease in the urine volume and can lead to complications. Next question. What are the best treatment for acute gout? In acute gout, there is an inflammation of the joint, so you need anti-inflammatory medications. There are 3-4 different classes of anti-inflammatory medications we use. Number one, the common and non-steroidals are ibuprofen and naproxen. Second class is colchicine. Third is we use sometime IL-1 inhibitors if your joints are very inflamed, but very rarely we use them as on a regular basis, because usually we give them only in the setting when you are admitted to the hospital and you happen to have acute flare-up. Usually those IL inhibitors and CARA are very expensive and we don't use it. And then the fourth class is the steroids. So anti-inflammatory medication, colchicine, prednisone, and IL-1 inhibitors. Those are the treatments for the acute. Next question, what are the best treatment for chronic gout? For chronic gout, we have 2 places to work on. Modify our diet so that we are not putting too much uric acid precursors into our body. But once it comes to the medication, we want to suppress the production of uric acid in the body, and that will be allopurinol and febuxostat. And then there is another medication which we use. This medication can push uric acid into another product which is called allantoin, and that medication is we are developing experience with that more and more, because what that does is allantoin is soluble in urine and can easily be dumped into this part. So we use allopurinol, febuxostat, and then medication to make it into allantoin, and then we use probenecid to push the uric acid into the urine. Next question, how can gout be prevented? Gout can only be prevented with our lifestyle change. That includes diet, which is low in purine precursors. We need to avoid red meat, organ meat, fish, red beans, black beans. We must not drink. We must keep ourselves hydrated. We must lose weight, manage our stress, sleep 7 to 9 hours every day. Can gout be cured? This is a difficult question to answer. As I said, 90% of the patients who develop gout, they have a problem with dumping uric acid into the urine. If you have those problems, chances of cure are less likely, but could be very successfully managed with medication and dietary changes. But if you have a short-term reasons, if you unfortunately you had a cancer which there was increased turnover cells, that chemotherapy was killing those cancerous cells, and there was increased production of those purines leading to high uric acid level, in those cases you could expect cure. But most of the time, if you have a problem in dumping uric acid into urine, it's a lifelong chronic disease. How does gout affect other parts of the body? In addition to involving skin, joint, next is the kidney. It can lead to chronic kidney disease, kidney failure, and even put you on a dialysis. What are the stages of the gout? There is no universal agreement on a very classified ways of what are the stages of the uric acid or the gout are. There is no agreement that on any kind of staging system on the gout. But we know that is people could have a high level of uric acid and may not have a flare-up or have a chronic complication or acute complication. Those we will call asymptomatic hyperuricemia, meaning you have a high uric acid level but you don't have symptoms. Or if you have a second class, will be people who have is high uric acid level and they get very infrequent acute attacks. And third will be the people who have high level and they have a chronic complications. But I want to be clear, there is no staging system which is universally agreed, and if it is, I am not aware of that. But I have done a lot of research and I keep up with this part. How does alcohol consumption affect gout? Alcohol interferes with the dumping of uric acid into your urine. That leads to building up of uric acid level, and they precipitate acute gouty attack or chronic complications. If you drink on regular basis, you will have recurrent acute gouty attacks because this the fluctuation in the level which precipitate those attacks, and you will have chronic complications. Every acute attack will lead to inflammation. Inflammation will lead to scarring, and scarring will lead to complications. How does soda affect gout? High fructose corn syrup, which is used as an artificial sweetener in almost everything, that interferes with dumping of uric acid into your urine, and that will lead to recurrent acute gouty attacks and chronic complications. If you have a gout, you must avoid anything which has high fructose corn syrup. How long acute gout attack lasts? Usually, like any other inflammation, acute gout can go for 3 to 7 days. It has a mind of its own. Sometimes it can last or linger into chronic problems. This is one of the problems which chronically we see. Most of the time, you have a one isolated joint which is affected by gout, but that's not the rule. Atypically, you could have multiple joints which are affected with the gout, and they will kind of mimic as if you have chronic degenerative osteoarthritis, and sometimes they are acutely inflamed in a way even with the trained eyes and physicians. The next question was, are there any natural remedies for gout? Definitely, when we talk about gout, anything which will decrease the load of purines in the body, leading to decreased production of uric acid, or we have a substance which helps to dump uric acid into the urine, will help us in preventing acute gout attack or chronic complications. Those include vitamin C, hydration, avoiding alcohol, avoiding organ meat, avoiding red meat. These are the things which we could use on natural basis. People have tried cumin, people have tried a lot of other spices which is helping to prevent gout attack. In olden days, there are certain roots like dark herb, they have been tried. They all work through being anti-inflammatory. They have a chemical which they block an enzyme called cyclooxygenase in the body, leading to decreased inflammation and leading to decreased complications. Next question is, how does dehydration impact gout? We have covered this one in detail, but we will go over the things regarding gout. Once you are dehydrated, the urine amount which is produced decreases and the flow decreases. That leads to increased precipitation of uric acid into your organ systems, especially the kidneys, and leading to chronic complication of gout and acute complications. Now we were entering the last part, that is, what are the 7 things you could do to stop or prevent gout? Those include, number 1, stop consuming high purine diet, which is organ meat, red meat, fish, and also red beans, black beans, and then these certain spices also. If you avoid them, you could prevent acute gout attack. Stop drinking sugary beverages, stop alcohol, stop overeating and maintain a healthy weight, stop eating high fructose corn syrup flavored foods, stop skipping water, and then the last 7th thing is stop ignoring signs and symptoms. We tend to ignore these symptoms, and then those symptoms lead to flare up of acute symptoms and chronic. This pain is very intense, so if the symptoms, do not ignore it, because it will be a miserable night. What are the 7 things you could do to prevent gout? Number 1, maintain healthy weight, stay hydrated, exercise regularly, limit alcohol, monitor uric acid level, and then take all the medication on regular basis. it is the fluctuation of level of uric acid that lead to acute attack and chronic complications. So you must stick to the medication religiously, because otherwise you will flare up or you will precipitate acute attack. And seventh is incorporate vitamin C and other supplements like cherries, omega-3 fatty fish, and coffee. Coffee is shown to prevent acute gouty attack. It's not a treatment. You have to drink a lot of coffee to prevent, but the cranberries, they all are shown to prevent it. So if you have a gout and you have to drink juice, it should be cranberry juice or some citrus juice. I hope this has helped you. You are able to understand gout more. We went through why you develop gout, what are the mechanisms are, what medications you have to take. We talked about acute attack, chronic attack, how to prevent, what are the lifestyle changes we could do. I will see you in next live session and the podcast. My name is Dr. Kulmeet Kundlas. Our YouTube channel is Kundlas MD, and also our Facebook page. Please like, share, and subscribe. And thank you very much for giving attention. And I will see you Saturday. Thank you.